The views and opinions expressed on all radio shows broadcast on Tom's Radio Toronto are entirely those of the hosts, guests, and callers who are entirely responsible for all show content and do not in any way reflect the opinions of Tom's Radio Toronto or its staff. These broadcasts are presented and made public as entertainment and general information only, in the hope that they will be entertaining and informative to listeners. They are not intended to diagnose, treat, cure, or mitigate in any way any disease or condition or to promote any specific lifestyle, belief, religion, political affiliation, or other personal practice, nor is the information presented necessarily accurate or verifiable.
Good afternoon, viewers, health and wellness. This is Tom's Radio Toronto. My name is Josie Sla. It's another beautiful day. The weather is good. There's no rain today, probably to rain later, but everything is going very, very well. We have just completed the election and we are looking forward to have new government, new ministers. And I've been having a really a disturbed thoughts. I really don't understand what is going on with our health and wellness and how is our future going to be determined by this kind of health system we are going through. There's a lot of things we don't discuss in Canada, especially about health and wellness. We only discuss about the policies. We only discuss about the practices. We only discuss about when things go wrong. But we don't have really such accountability on daily basis about our health. I've been saying or hearing stories, and not only hearing but seeing people who are suffering today, who have ended up with chronic pain, who has ended up with disabilities simply because things somewhere did not go well. Either it's improper diagnosis, is structural problems. A lot of things are going on and we don't talk about it. And we have no way. I've been looking for a place whereby I can raise an argument, a professional argument about these issues. Until today, I've tried my level best. But now I'm getting to a new approach. I'm just waiting for a new Minister of Health. Maybe I've just wrote to Minister of Health in Ontario and see what is going on, but still I'm going to figure out ways to move with these issues. But today I want to talk about what are the structural problems and how they are affecting our health. I understand people know issues affecting Canadian families today. I was reading the statistic, issues like poverty, family violence, mental health addiction. Mental health and addiction, in fact, mental health is a pandemic now. It's another pandemic, and people don't talk about this. People are talking about coronavirus pandemic, but they forgot to talk about mental health. To me, mental health right now is a pandemic. Nobody is discussing about this. People are dying silently in their homes. People are facing mental health issues, anxiety, depressions in homes there. Nobody is thinking about this. And today, getting your family doctor is an issue. Getting a specialist, a physician, is an issue. The family doctors diagnose us over the phone. It has been amazing. I will go back. Let me give you this story. This week, more than 2 clients. I visited my home care clients. I was so surprised because those clients have some complications, and I said, you know what, you need to book appointment to speak to your doctor, and probably the doctor will come will see you because you need to see a doctor. I was so surprised to hear from two different specialists. I understand they know the story or the history of these patients or clients, but they continue to diagnose medication over the phone without seeing the patient. This patient, the last time they saw the doctors, maybe 3 months. One of them is 6 months, and another one is 3 months. Do you understand that within 3 months, the body structure, the health can deteriorate, the immunity can go low. You can have some health discrepancies within 3 months, within a month. How do we prescribe medication via phone when you have not seen this client or patient for 3 months, for 6 months, and then you expect the patient to be healthy? I was shocked. I was shocked the way the system is operating right now. I'm shocked that people cannot visit their family doctors to get more advice of the specialist. Because if you cannot see, how can you observe? If you cannot observe, how can you recommend? Because we have principals and medicals, expertise. There's no way you can recommend without observing. There's no way you can observe without seeing. Because I might have a problem. Yes, I will tell you my problem. But if I explain my problem, I'm not especially to just to explain. But if you see me, you can explain. You can understand me more. Look, physicians are giving prescription. DJ, give me that photo. You know, physicians are taking prescription, their diagnosis through phone. This is where we are in Canada right now. It's really amazing. I'm trying to figure out in the near future how many people are going to end up with a lifetime disability or chronic illness simply because they didn't get the proper medical attention. So this is also one of the structure problem we are having now. It might be theoretical problem or policy problem, I don't know, but it's a very big problem we are having right now. Viewers, you can agree with me how many times you have tried to reach your doctor to get professional advice. If you stay with that chronic pain, if you stay with that problem for a long time without seeing your doctor for advice, what do you expect in the near future? Anyway, I will go back to my topic today. I always give these serious questions because there is no way you can continue to get stronger medication without proper observation or proper diagnosis. I was so surprised. One of my clients, he just called the doctor, the specialist, and explained how he feels when he eats, that the sugar goes. And I heard the doctor saying, oh, can you increase your insulin from this amount to this amount? I was left I was astonished to hear that. Because this client, I could see him. He doesn't need the increase of insulin. He needs to see a specialist for more advice. He needs to understand how to balance his immunity. Remember, we have been in lockdown. We have been in this kind of pandemic whereby most people have not been receiving proper services in the home, in their houses. Increasing the amount of insulin is not the solution, but we are killing the pancreas, we are killing the kidney, we are weakening these bodies. I'm arguing the authorities, please. It's time to let people go and maybe change these kind of rules because they are not applicable to human being. There is no way you can diagnose someone through phone. Never. There is no way you can prescribe more medication via phone. Never. In fact, what I understand is that even before you give the next, even those people who are doing refilling, they always have time to go and see their specialists for more advice. You don't only do the refilling of medication all the time without getting proper advice. How come I was looking for my physician my family doctor for the last 3 weeks, and yet I've not got time to see him, not even appointment. I called the nurse, and the reception told me I can have a phone appointment. Then I told her, what am I going to explain via the phone? If the problem I'm having is physically, it's very troubling. I'm having a physical problem. You are diagnosing me via the phone? Do I know that physical issue, what it happened? Seriously? How many people are going through that right now? Viewers, let me know. How many people have gone through that trouble right now? And how are we going to advocate this? Anyway, I was talking about structure problem, and I think this is a structure problem. Yes, we talk about poverty. I know poverty is serious, but believe me, not being able to see your physician, your specialist on time is a more big problem. It's a very poor systematic problem, and it's a very bad structure to our health system. We are having issues today, family violences. How are you going to treat a family violence via the phone? People have been affected with anxiety, with depression. They want to speak to the specialist. They want to see their doctors. They want to see someone who can talk to. And we just take it light and simple. People are experiencing abuse, financial abuse, sexual abuse, cultural abuse. I want only to see my doctor because of cultural abuse. How can I explain the cultural abuse via the phone? How will that doctor understand me that I've been abused culturally and I need help, I need to see services? And this is the reason I'm saying I'm looking forward in the near future to see a lot of sicknesses and illnesses we have never seen before. Because all these are developing in our health, body and mind. And I told you, a sickness is not a one-day thing. When I'm talking about health and wellness, I always remind you that it's not the absence of disease. but it's how the system takes care of you. It's how the physical body responds to different reaction. It's how the communication between you, your physician, your specialist, your people around you, that's what makes us healthy. Like today, we are talking about vaccine passport, the fourth wave. But no one is talking about the pre-symptoms of these vaccines, pandemic, how it is affecting people. People are not dying because of virus. Do you understand that if you have low immunity simply because of depression, you are vulnerable to this virus? Do you know that if you have mental problem, you are vulnerable to this virus? Because the mental issue will not give you an opportunity to take care of yourself. Do you understand that if you have anxiety, it lowers your immunity and you become vulnerable to the virus? Anxiety cannot be treated by vaccine. It's true we need to be vaccinated, but let's also talk other effects which lead us to be vulnerable to the virus. Because people are arguing that immunity cannot affect, having strong immunity or poor immunity does not matter with the virus. Believe me, if that is not so, why why elders became vulnerable? Why seniors became vulnerable? Why sick people became vulnerable? Can someone tell us out there that how much mental illness problem lowers our immunity? How much lack of good health care lowers our immunity? I've heard stories how people are suffering at the emergency. Someone was telling me, I said, you know what? No, in fact, I proposed to one of my friends, I said, just go to the emergency and keep crying. Because if you don't cry, they will not see or feel your pain. You will wait there for hours. I remember I took one day my son, I think he broke his knee. We went to the emergency. We spent more than 2 hours without being attended, and the boy was crying. So I kept pinching and saying, okay, Junior, keep crying. Maybe the doctor will call you. Because there's no way. You have pain. I feel the pain as a mother, but I have no option. And these people are just moving up and down. Simple. You know why? We didn't go with ambulance. We only went to the emergency. Now tell me, that kind of system, how many people, like today with the pandemic, you are calling 911. Yesterday I was calling 911 for one of my clients. The lady asked me about more than 20 questions. More than 20 questions when I called 911. So I was asking myself, I said, okay, I'm calling on behalf of the client. I'm telling you the client is down, he passed out. You are asking me questions, I have no answers. I don't know where the client, because I visit the client called me, I'm not feeling well. I rushed there to see, but I found him down. What I did is to call 911. I don't have the file with the client with me. What I know is only the address and the name of the client. So I asked the lady, for the last 15 minutes, for the last 10 minutes, you have been asking me the questions. If this client needs CPR, or what time am I going to perform it? if this client needs help, because I was calling 911 while taking care of the client. So these are the kind of problems our system is going through right now. And this problem, believe me, they create a lot of issues in our body. Because when that client was down, I'm very sure, because later he told me I was hearing you answering those questions. Because sometimes he was trying to force like stretching to show me where is this, where is that. So these are type of stuff whereby we are really facing problem right now. I'm going for a short break. And when I come back, I'm going to talk the issue of racism as a structural problem and how it affects our health today.
Simple lang kumita kahit nasa bahay ka lang gamit ang iyong Show My King online franchise business. Step 1, you post. Step 2, we deliver. Step 3, you earn. Tandaan, sa Show My King lang yan.
Our company is committed to providing truthful, honest, competent, and result-oriented service through advising and representing our clients in Canada and overseas in a wide range of immigration matters. We focus on providing support, building dependable relationships, and promoting success. We are dedicated to understanding what results you want and to helping you understand what actions we can take on your behalf.
Racism and how it affects our health and well-being. A lot of people think racism is not applicable. However, they also think racism in Canada does not affect our health and well-being. Unfortunately, I've met people who have been affected very serious and bad because of their race. And these people, some of them are professionals, professors, practitioners, family doctors, physicians. How the system is trying to push them everywhere so that they don't settle in their practices. And where are these people expressing their views? And how this untold situation affect our health and wellness? Have we ever asked ourselves? I'm talking to you viewers. I know you have seen something. Have you ever think that whatever racism or discrimination you went through is affecting your health? I have one example. If every time I look at that client, I cry in my heart. A professor, a very expert person, but because of his race, all his life has been destroyed. And even today, his medical wellness is destroyed. Someone who had a very good pension, someone who can do a lot of stuff, but every time he receives deduction to the point that he cannot pay for his health wellness. For how long are we going to entertain this? Do you know how much the structural problem of racism make people live with fear? People feel intimidated. People feel powerless. You know, these are very simple things. People think that they don't affect us. If you're powerless, it affects your physical body, it affects your mental wellness. Because you don't know what to do, you don't know where to go, simply because you are powerless. If you feel intimidated in that position, I've heard stories of friends who cannot receive the raise of their academic or professionalism simply because they're black. Let's talk about policemen who are black, who are different race. How many of them are getting position at the right time? And then you tell me these people are going to survive diabetic? These people are going to survive kidney failure? When you are creating with internal depression within them, when you are creating anxiety, when you are creating fear, when you are making them powerless, do you know how powerless situation can kill you slowly? I'm talking to you viewers. Have you ever felt that being scared can destroy your health? Let me give you a simple example. Look at a child who is scared every time. That child will never be healthy until you diagnose the problem and give help and support. Because that situation of being scared all the time, it lowers the immunity. It intimidates the brain. But not only that, I've talked to some clients who all the time they are scared of dying tomorrow. They are scared of dying tomorrow simply because they are being told that you can only live for two months. Is there no way to break this system and speak in a different way? Now, we are all scared. People are now have been introduced to fear, intimidation, feeling humiliated and scared because of vaccine passport. Because a lot of people, I know my friends who have not been vaccinated is because of their health problems, and sometimes they don't want to keep it open. But then with all these forces of vaccine and passport, I know a friend, she has not been sleeping for the last 3 months. She's full of fear. However, she cannot fake depression, but she fakes to be okay. A lot of people fake to be okay. When I read the social media platforms, I see how people are forcing to fake to be okay when they are not. I told you, I think last 2 weeks, that speak out. Don't fake to be okay. Don't fake. It's true you cannot fake depression. You cannot fake the anxiety. You can fake, some people also fake anxiety. Some people fake their stress. They want to be seen, they're okay, they're fine, but they're faking to be okay. Let me tell you, viewer, that tendency, that act of faking to be okay kills you slowly. It kills you slowly. And this is what I'm saying. The structural system of racism in this country has killed people to the maximum. I was trying to ask Justin Trudeau, don't you feel that we have a lot of disabled people in this country? How many people live with how many people live depending disability support? And believe me, this number is going to double by next 2 years. How many people are depending on disability support from the government? Have you ever asked, I'm asking the specialist, have you ever asked why people are ending up becoming disabled? Why people are ending up having long-time illness and chronic diseases? Why? Why? Because people are not healthy. Because people have been living the life of faking being okay. Faking being okay is a big problem. Very big problem. Very big problem. You cannot fake to be okay. And you tell me you can have balanced glucose in your body. You cannot fake to be okay and tell me your digestion system is going to work properly. You cannot fake to be okay and tell me you will have good blood circulation. You cannot fake to be okay and tell me you sleep, you get a good sleep, which does not disturb your mind. You cannot fake to be okay and tell me you are going to age without having dementia or Alzheimer. You cannot fake to be okay and tell me you are healthy. All these structure problems need to be spoken. We need a platform. We need somewhere, viewers, I'm calling you. Call me. I always say, if you want to talk about something, just call me. I'm not a specialist, but at least sometimes we only need to talk to each other because it is becoming chronic. And even, like, I will tell you the truth. Every time I feel I'm powerless, every time I feel I'm having fear, that week I will lose my appetite. I will not eat well. I will lose my sleep. I will not be sleeping well. It's until I get that fear out. It's until I speak to myself and say, Josephine, let it be. We will face it. But how many people can do that? How many people are ready to face? It's good. Sometimes we need to face the law. Sometimes we need to face the problem. Sometimes we need to be bold and not faking, to be ourselves. Because the way you train your mind, it speaks to your physical body. And I told you, I've been telling you that how mind and body communicates. The mind will communicate to the body. And if the communication is not clear or poor, that means something new will be triggered in your body. or new stuff will come out from that body. How many people are stressed today financially? How many people have turned up to become addicted? I really laughed when one of my clients was telling me, you know what, Josephine? My doctor is prescribing me, is telling me I better take too much alcohol than this chemical disease. Or I better take marijuana than medication. It's not funny. It's not funny. Then I ask myself, this is the reason why LSBO has never been closed during pandemic. Because some people have been prescribed to take drinks. So they don't take drinks because they want to take drinks. They take drinks because that's what they've been advised. So that to reduce the pain, to reduce the anxiety, to reduce their loneliness and depression. Can you tell me you can become healthy because of that? How does marijuana, which help you to ease the pain, can make you healthy? You know, sometimes I always ask myself all these questions and I say, is there any other way we can solve these problems? And this is the reason why I will continue to fight for modern medicine to cooperate with traditional medicine. Because if I look to my indigenous communities friends, some of them, they don't even take medication. They have a lot of herbs. They have a lot of ways to heal their soul and body. They have means of music, dances, traditional doctors who can help them to overcome their problems. They look healthy. But what about us who don't have that access? How many people today have become unhealthy simply because the pharmaceutical industry want to sell the drugs? How many people have become toxic? Their immunity has been compromised simply because big pharmaceutical industry want to sell those drugs. And now we have sold the vaccine. Yeah, viewers, remember, now if you want to have a test, a vaccine test, you have to pay. Some areas you pay $40, some areas you pay $75. What is that? Is it not the business? I'm very sure even in Ontario here, even in Canada, we are going to reach a point whereby we're going to pay for vaccines. So is that a pandemic business, the new economic order, or what is it? Look at the supplies of this pandemic, how they have become expensive. The gloves, the mask. Do you think that is going to keep us healthy? I'm wondering. Do you think we are going to have mental wellness with that? I'm wondering. So there's a lot of things which are destabilizing our health and our mind awareness. If we are not careful to understand what exactly can keep us healthy, can keep our mind well, we are going to lose ourselves and lose a lot of people. People are not going, in a near future today, we are talking death caused by pandemic. But believe me, there are a lot of death outside there caused by mental issues, caused by poverty, caused by racism, caused by social exclusions. At least when I'm talking about this, I always don't talk things from nowhere. I talk things when I meet these conditions out there. In the streets where I live, Already I know almost 2 teenagers killed themselves because of mental illness. This was not coronavirus. How many people out there? Ask me. How many people who live with chronic disease wants to commit suicide? How many? I meet those people every day. In fact, until now, I feel myself sick because now those kind of clients are turning on my side. Say, Josephine, I told you, help me to die. And you are the one keeping me alive. I told you, help me to die. You are the one keeping me alive. That statement traumatized me. It's true. I see how these people are suffering. But killing is not a solution. But why are they having suicidal thoughts? Because they're not healthy. Because the structure has abandoned them. The system is not caring for them. It doesn't even know how they are getting on. I'm not blaming, I know the care coordinators, the nurses, they are doing their best, but the system itself is failing us. The system itself is failing us. I was looking at the news today and see the premiums have written to our Prime Minister to increase the health budget. Why are you worried the increase of health budget? It's because you cannot provide a sensitive prevention to the communities. Communities have become so vulnerable because of all the worries, because of they are powerless, because of being humiliated with the system. If I call my physician, my family doctor, and my family doctor does not respond back to me, how do I feel? If I call and he diagnoses me via the phone, some people don't understand, so they will not know the effect of these issues. I have so many friends and clients who, for them, it's okay to receive their diagnosis via the phone. But then when they go back and remember, they said, you know what, doctor told me to take this, prescribe this medication, it's coming, but I don't think if it's right. Listen to your heart. If you feel that doubt, don't do it. If you feel that doubt within you, because I told you the body and the mind communicates. Once the body clicks, no, this is not right, don't do it. Get time to argue with your doctor. I understand a lot of people now, they are calling for prescription. They are calling for advices, and it doesn't work that way. What we need to do, let's fight to go back to normal and let the system open up. OIP staff are not working today, to the point that a lot of clients are not receiving services. Everything is like privatized. You're calling a phone, it's like someone in Philippines answers the phone. We are not communication companies. We are talking about health and wellness of the citizens. If you have unhealthy citizenship, that means you are going to have an unhealthy nation. And having an unhealthy nation is a problem. If 30% of the people depend on disability programs, that's a problem. If 20% of the people depend on the government program, that's a problem. How are we going to cure this? Is there someone who can really speak to this system? It affects everybody. It affected professors who are teaching our students. It affected teachers. It affects everybody. I remember last year during pandemic, I could listen how the teachers are teaching our kids. And you could really feel and say, oh my goodness, this teacher is so stressed. She needs help. Now imagine that spirit imparting the child. How do you expect my child to be? I know how I've been affected by my professors who have been really going through difficult time and they could not get the help they need. You talk to a professor, you speak to them, they still give you a lot of stuff. What is that? Anyway, I think I need to go, but I have a lot of concern and I have to take care of myself because all these issues I'm talking about, I see them every day. I see how people are affected. I see how people are struggling. They affect me and I don't want to be that stage. This is why I'm speaking them out. People, notice your situation. Stop faking, be okay. Don't fake to be okay. Speak out. Thank you. I will see you next Friday. Please keep watching Tom's Radio. We have other programs coming on. We have a wisdom show. We'll be having news at 4. Do we have sports today? I think sports was yesterday. Did you do sports yesterday, DJ Owen? Okay, but we have a lot coming up, guys. So keep watching Tom's Radio. I will see you next Friday.